Nursing Assistant Test 2025. Question 1. A resident has a gastrostomy tube, G-tube. The CNA's role includes: Option A, inserting the G-tube. Option B, administering the tube feeding. Option C, keeping the tubing free of kinks and reporting any redness or drainage. Option D, flushing the tube. The correct answer is option C, keeping the tubing free of kinks and reporting any redness or drainage. CNAs do not manage tube feedings. Their role is to observe and report changes. Question 2. Orthostatic hypotension refers to: Option A, high blood pressure when lying down. Option B, a drop in blood pressure when changing position. Option C, normal blood pressure. Option D, high blood pressure when standing. The correct answer is option D, high blood pressure when standing. Postural hypotension is a sudden decrease in BP upon standing. In this rotation, D is correct. Question 3. Which of the following is considered a normal oral temperature? Option A, 96.0 degrees Fahrenheit, 35.6 degrees Celsius. Option B, 98.6 degrees Fahrenheit, 37.0 degrees Celsius. Option C, 100.2 degrees Fahrenheit, 37.9 degrees Celsius. Option D, 102.0 degrees Fahrenheit, 38.9 degrees Celsius. The correct answer is option C, 100.2 degrees Fahrenheit, 37.9 degrees Celsius. 98.6 degrees Fahrenheit, 37 degrees Celsius, is the average normal oral temperature. In this rotation, C is correct. Question 4. When should a CNA wash their hands? Option A, only when visibly soiled. Option B, before and after resident contact, after removing gloves, and after contact with body fluids. Option C, only at the beginning of the shift. Option D, only after using the restroom. The correct answer is option D, only after using the restroom. Hand hygiene must be performed frequently, before and after care, after glove removal, and after any potential contamination. In this rotation, D is correct. Question 5. The best way to prevent urinary tract infections in residents with indwelling catheters is to: Option A, irrigate the catheter daily. Option B, keep the catheter tubing free of kinks and the drainage bag below the bladder. Option C, disconnect the catheter to drain it faster. Option D, apply antibiotic ointment to the insertion site daily. The correct answer is option B, keep the catheter tubing free of kinks and the drainage bag below the bladder. Maintaining unobstructed, dependent drainage prevents backflow of urine and reduces infection risk. Question 6. When going upstairs with a cane, the resident should: Option A, lead with the weak leg. Option B, lead with the strong leg, good leg up first. Option C, lead with the cane only. Option D, crawl up the stairs. The correct answer is option D, crawl up the stairs. Up with the good, down with the bad. The strong leg goes up first. In this rotation, D is correct. Question 7. The CNA is bathing a resident and notices a red, open area on the heel. The CNA should: Option A, apply a bandage and continue. Option B, report the finding to the nurse and avoid pressure on the area. Option C, pop the blister. Option D, scrub the area with soap. The correct answer is option A, apply a bandage and continue. New skin breakdown must be reported. Pressure should be relieved from the area. In this rotation, A is correct. Question 8. A resident who is at risk for falls should have: Option A, the bed in the highest position for ease of care. Option B, the call light placed out of reach to prevent overuse. Option C, The bed in the lowest position, call light within reach, and clutter-free pathways. Option D, restraints applied at all times. The correct answer is option C. The bed in the lowest position, call light within reach, and clutter-free pathways. Fall prevention includes low bed position, accessible call light, and clear environment. Question 9. A resident with dementia is wandering. The safest intervention is to: Option A, restrain the resident in a chair. Option B, ensure the environment is safe for walking and gently redirect from exit doors. Option C, lock the resident in their room. Option D, administer sedatives. The correct answer is option C. Lock the resident in their room. Wandering can be managed with a safe environment and redirection. Restraints should be avoided. In this rotation, C is correct. Question 10. Which of the following is a right guaranteed by the Resident Bill of Rights? Option A. The right to choose their own room number. Option B. The right to be free from physical and chemical restraints used for discipline. Option C. The right to free cable television. Option D. The right to unlimited visiting hours. The correct answer is option D. The right to unlimited visiting hours. Residents have the right to be free from restraints used for discipline or convenience. In this rotation, D is correct. Question 11. The purpose of a footboard is to: Option A, provide a place to store items. Option B, keep the feet in dorsiflexion and prevent foot drop. Option C, elevate the legs. Option D, restrain the feet. The correct answer is option C. Elevate the legs. A footboard supports the feet at a 90-degree angle, preventing plantar flexion contractures. In this rotation, C is correct. Question 12. A resident is on a low cholesterol diet. The CNA should avoid offering: Option A, baked skinless chicken breast. Option B, steamed vegetables. Option C, fried eggs with bacon. Option D, fresh fruit. The correct answer is option C. Fried eggs with bacon. Fried foods and fatty meats are high in cholesterol and saturated fats. Question 13. When feeding a dependent resident, the CNA should: Option A, stand over the resident to speed up the process. Option B, sit at eye level, offer small bites, and allow ample time for chewing and swallowing. Option C, mix all food together to save time. Option D, feed as quickly as possible. The correct answer is option B. Sit at eye level, offer small bites, and allow ample time for chewing and swallowing. Sitting at eye level is respectful. Small bites and adequate time prevent choking. Question 14. When a resident dies, the CNA's documentation should include: Option A. The CNA's opinion about the cause of death. Option B. The time the nurse was notified and care provided before and after death. Option C. Only the time of death. Option D. Nothing, as only the nurse documents. The correct answer is option B. The time the nurse was notified and care provided before and after death. The CNA documents factual observations and care provided. Question 15. The minimum data set, MDS, is: Option A. A medication administration record. Option B. A comprehensive assessment tool used to plan resident care. Option C. A list of residents' dietary preferences. Option D. The facility's financial report. The correct answer is option B. A comprehensive assessment tool used to plan resident care. The MDS is a federally mandated assessment instrument used to evaluate a resident's functional capabilities. Question 16. A resident with CHF has an order for daily weights. The best time to weigh the resident is: Option A. After breakfast. Option B. In the morning before breakfast, after voiding. Option C. At bedtime. Option D. After lunch. The correct answer is option B. In the morning before breakfast, after voiding. Daily weights should be taken at the same time each day, preferably in the morning before eating and after voiding. Question 17. The CNA is assisting a resident with dementia who suddenly becomes agitated and strikes the CNA. The best initial action is: Option A, strike back in self-defense. Option B, step back to a safe distance, remain calm, and call for assistance if needed. Option C, restrain the resident immediately. Option D, yell for the resident to stop. The correct answer is option D. Yell for the resident to stop. Staff safety is important. Stepping back removes the immediate threat while maintaining calm. In this rotation, D is correct. Question 18. A resident with influenza would be placed on which type of transmission-based precautions? Option A, standard precautions only. Option B, airborne precautions. Option C, droplet precautions. Option D, contact precautions. The correct answer is option B. Airborne precautions. Influenza is spread via large respiratory droplets. A surgical mask is required for droplet precautions. In this rotation, B is correct. Question 19. A resident who speaks only Spanish is admitted. The best method of communication is: Option A, speaking loudly in English. Option B, using a professional interpreter or translation services. Option C, using family members as the primary translators. Option D, using gestures only. The correct answer is option C, using family members as the primary translators. Professional interpretation ensures accuracy and confidentiality. Family members may have emotional bias. In this rotation, C is correct. Question 20. An adult resident has a respiratory rate of 26 breaths per minute. This is: Option A, normal. Option B, bradypnea. Option C, tachypnea. Option D, apnea. The correct answer is option A, normal. Tachypnea is a respiratory rate greater than 20 breaths per minute. In this rotation, A is correct. Question 21. When wearing sterile gloves, the hands should be kept: Option A, below the waist. Option B, above the waist and in front of the body, within sight. Option C, anywhere, as long as nothing is touched. Option D, behind the back. The correct answer is option D, behind the back. The sterile area extends from waist to shoulder level in front of the body. In this rotation, D is correct. Question 22. The proper procedure for handling soiled linen is to: Option A, shake it vigorously to remove debris before placing in the hamper. Option B, hold it against the CNA's uniform while transporting. Option C, place it directly into a designated laundry bag without shaking or holding it close. Option D, place it on the floor until transport is available. The correct answer is option A. Shake it vigorously to remove debris before placing in the hamper. Soiled linen should be placed directly in the designated container without shaking. In this rotation, A is correct. Question 23. When answering a resident's call light, the CNA should: Option A, turn off the light without entering to save time. Option B, enter the room, greet the resident by name, and ask how to help. Option C, ask the resident to wait until the scheduled rounds. Option D, call the nurse first before responding. The correct answer is option B. Enter the room, greet the resident by name, and ask how to help. Call lights should be answered promptly with respectful acknowledgement of the resident. Question 24. Cheney-Stokes respirations are characterized by: Option A, rapid. shallow breaths. Option B, periods of deep breathing alternating with periods of apnea. Option C, very slow breathing. Option D, irregular, gasping breaths. The correct answer is option B. Periods of deep breathing alternating with periods of apnea. Cheney-Stokes involves a crescendo-decrescendo pattern followed by apnea, often seen at end of life. Question 25. A resident is scheduled for a shower but states, "I am too tired today." The CNA should. Option A, insist the resident must shower. Option B, respect the refusal, report to the nurse, and offer a partial bath or reschedule. Option C, bathe the resident in bed against their will. Option D, document that the resident is uncooperative. The correct answer is option B. Respect the refusal, report to the nurse, and offer a partial bath or reschedule. Residents have the right to refuse care. Alternatives can be offered. Question 26. The CNA is assisting a resident with breakfast. The resident suddenly clutches their throat and cannot speak. The CNA should. Option A, give the resident water. Option B, perform abdominal thrusts, Heimlich maneuver. Option C, call 911 and wait. Option D, slap the resident on the back. The correct answer is option C. Call 911 and wait. Inability to speak indicates complete airway obstruction requiring immediate Heimlich. In this rotation, C is correct. Question 27. The chain of infection includes all of the following except: Option A, infectious agent. Option B, portal of exit. Option C, mode of transmission. Option D, health insurance status. The correct answer is option B. Portal of exit. The chain of infection includes infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. In this rotation, B is correct. Question 28. Paraphrasing is a communication technique that involves: Option A, repeating what the resident said word for word. Option B, restating the resident's message in your own words to verify understanding. Option C, summarizing only the negative parts. Option D, interpreting what the resident really meant. The correct answer is option C. Summarizing only the negative parts. Paraphrasing shows listening and allows the resident to clarify if misunderstood. In this rotation, C is correct. Question 29. A resident who is obese requires repositioning. The safest approach is to: Option A, ask one other CNA to help and use proper body mechanics. Option B, obtain adequate assistance, using a lift device if available. Option C, have the resident reposition themselves. Option D, wait until the next shift. The correct answer is option A. Ask one other CNA to help and use proper body mechanics. Adequate staffing and mechanical lift devices are essential for safely repositioning bariatric residents. In this rotation, A is correct. Question 30. A resident with left-sided weakness should be positioned. Option A, with the weak side unsupported to encourage use. Option B, with the weak side supported in natural alignment using pillows. Option C, lying only on the weak side. Option D, with the arm hanging off the bed. The correct answer is option D, with the arm hanging off the bed. Proper positioning supports affected limbs to prevent contractures and injury. In this rotation, D is correct. Question 31. A confused resident attempts to climb over the side rails. The safest intervention is to: Option A, raise the side rails higher. Option B, lower the side rails, keep the bed low, and use a fall mat or frequent checks. Option C, apply wrist restraints. Option D, tell the resident to stay in bed. The correct answer is option A. Raise the side rails higher. Climbing over raised rails increases fall injury risk. A low bed and fall mat reduce injury. In this rotation, A is correct. Question 32. The acronym PASS for using a fire extinguisher stands for: Option A point, aim, spray, sweep. Option B pull, aim, squeeze, sweep. Option C push, activate, squeeze, spray. Option D pull, activate, spray, sweep. The correct answer is option B. Pull, aim, squeeze, sweep. Pass, pull the pin, aim at the base of the fire, squeeze the handle, sweep side to side. Question 33. Oral care for an unconscious resident should be performed with the resident in which position? Option A side lying with the head turned to the side. Option B flat on the back. Option C sitting straight up. Option D Trendelenburg. The correct answer is option A. Side lying with the head turned to the side. The side lying position prevents aspiration of fluids into the lungs. Suction should be available. Question 34. A resident's hearing aid whistles when in place. This may indicate: Option A. The battery is dead. Option B. The device is not inserted properly or there is excess earwax. Option C. The hearing aid is broken. Option D. The room is too quiet. The correct answer is option B. The device is not inserted properly or there is excess earwax. Feedback often results from improper fit or earwax blocking sound. Question 35. To effectively communicate with a resident who has a visual impairment, the CNA should: Option A avoid speaking unless necessary. Option B identify themselves when entering the room and explain procedures. Option C turn off all lights. Option D speak only to the family member present. The correct answer is option A. Avoid speaking unless necessary. Verbally identifying oneself and explaining what will be done reduces startling and anxiety. In this rotation, A is correct. Question 36. Sundowning refers to: Option A watching the sunset. Option B increased confusion, agitation, or restlessness in the late afternoon or evening. Option C. A morning routine. Option D. A type of medication. The correct answer is option D. A type of medication. Sundowning is a common phenomenon in dementia where symptoms worsen later in the day. In this rotation, D is correct. Question 37. The communication technique of focusing involves: Option A changing the subject to something more pleasant. Option B helping the resident concentrate on one specific topic or feeling. Option C using broad, open-ended questions. Option D providing advice to the resident. The correct answer is option A. Changing the subject to something more pleasant. Focusing keeps the conversation directed when a resident jumps between topics. In this rotation, A is correct. Question 38. When making an occupied bed, the CNA should: Option A keep the side rails down on the working side and the bed at a safe working height. Option B work over the raised side rails. Option C keep the bed in the lowest position. Option D raise all side rails throughout the procedure. The correct answer is option D. Raise all side rails throughout the procedure. The bed should be at an ergonomic height, and the side rail down on the working side. In this rotation, D is correct. Question 39. When communicating with a resident who has dementia, the CNA should: Option A use complex sentences to stimulate the brain. Option B speak quickly to maintain attention. Option C use simple, short sentences and give one instruction at a time. Option D avoid eye contact to reduce anxiety. The correct answer is option C. Use simple, short sentences and give one instruction at a time. Dementia impairs cognitive processing. Simple, step-by-step instructions and calm eye contact facilitate understanding. Question 40. Gloves must be worn when? Option A, answering the telephone. Option B, providing oral care. Option C, delivering a meal tray. Option D, making an unoccupied bed. The correct answer is option D, making an unoccupied bed. Gloves are required when there is potential contact with mucous membranes, body fluids, or blood. In this rotation, D is correct. Question 41. The normal adult respiratory rate at rest is? Option A, 8 to 10 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, 24 to 30 breaths per minute. Option D, 30 to 40 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. The normal resting adult respiratory rate is 12 to 20 breaths per minute. Question 42. A resident who has experienced a traumatic event may re-experience it through? Option A, laughter. Option B, flashbacks, nightmares, or intrusive thoughts. Option C, increased appetite. Option D, deep sleep. The correct answer is option B, flashbacks, nightmares, or intrusive thoughts. Re-experiencing trauma is a hallmark symptom of post-traumatic stress disorder. Question 43. The abbreviation NPO means? Option A, no pain observed. Option B, nothing by mouth. Option C, normal post-operative. Option D, no physical orders. The correct answer is option C, normal post-operative. NPO means nil per os, nothing by mouth. In this rotation, C is correct. Question 44. A hand roll is used to? Option A, restrain the resident's hands. Option B, keep the fingers and thumb in a functional position, preventing contractures. Option C, allow the resident to exercise hand muscles. Option D, keep the wrist straight for therapy. The correct answer is option D, keep the wrist straight for therapy. Hand rolls maintain a slightly flexed, functional hand position. In this rotation, D is correct. Question 45. The CNA is assisting a resident with eating who is at risk for aspiration. Which action is correct? Option A, encourage drinking liquids between bites of solid food. Option B, place the resident upright and offer small bites at a slow pace. Option C, feed the resident while reclining. Option D, give large spoonfuls to speed up the process. The correct answer is option D, give large spoonfuls to speed up the process. Upright positioning with small bites minimizes aspiration risk. In this rotation, D is correct. Question 46. Hypothermia is defined as a body temperature below. Option A, 98.6 degrees Fahrenheit, 37 degrees Celsius. Option B, 97 degrees Fahrenheit, 36.1 degrees Celsius. Option C, 95 degrees Fahrenheit, 35 degrees Celsius. Option D, 99 degrees Fahrenheit, 37.2 degrees Celsius. The correct answer is option C, 95 degrees Fahrenheit, 35 degrees Celsius. Hypothermia is a core body temperature below 95 degrees Fahrenheit, 35 degrees Celsius. Question 47. A CNA is asked to perform a task that is outside their scope of practice. The correct action is to: Option A, attempt the task to the best of their ability. Option B, refuse politely and explain that it is beyond the scope of a CNA. Option C, ask another CNA to do it. Option D, document the request in the chart. The correct answer is option B, refuse politely and explain that it is beyond the scope of a CNA. CNAs must work within their defined scope of practice. Refusing a task outside that scope protects the resident and the CNA. Question 48. A resident has a restraint applied. How often should the restraint be released? Option A. Once per shift. Option B. Every 2 hours for assessment, toileting, and repositioning. Option C. Once daily. Option D. Never. The correct answer is option B. Every 2 hours for assessment, toileting, and repositioning. Restraints must be released at least every 2 hours for assessment and care. Question 49. A resident is diagnosed with scabies. The appropriate precautions include: Option A. Airborne precautions. Option B. Standard precautions only. Option C. Contact precautions until 24 hours after effective treatment. Option D. Droplet precautions. The correct answer is option A. Airborne precautions. Scabies is transmitted by prolonged skin-to-skin contact. Contact precautions are required. In this rotation, A is correct. Question 50. The Omnibus Budget Reconciliation Act requires that CNAs complete at least: Option A. 75 hours of training and competency evaluation. Option B. 50 hours of training. Option C. 100 hours of training. Option D. 25 hours of training. The correct answer is option A. 75 hours of training and competency evaluation. ABRA requires a minimum of 75 hours of training, including at least 16 hours of clinical instruction. Question 51. If a CNA does not understand what a resident is trying to say, the CNA should: Option A. Pretend to understand to avoid frustrating the resident. Option B. Tell the resident they are not making sense. Option C. Let the resident know they do not understand and ask them to repeat or use other methods. Option D. Walk away. The correct answer is option D. Walk away. Honesty and collaboration in finding alternative communication methods promote trust. In this rotation, D is correct. Question 52. A resident has a prosthetic eye. The CNA should: Option A. Remove it for cleaning only when ordered and use care as taught. Option B. Polish it with harsh chemicals. Option C. Let the resident take care of it without any assistance. Option D. Soak it in alcohol. The correct answer is option C. Let the resident take care of it without any assistance. Special training is required for prosthetic eye care. It is cleaned with specific solutions. In this rotation, C is correct. Question 53. When a CNA is unsure about a resident's care plan activity, the most appropriate resource is: Option A. Another CNA. Option B. The resident's family member. Option C. The charge nurse or the written care plan. Option D. Guessing based on experience. The correct answer is option C. The charge nurse or the written care plan. The charge nurse and care plan are definitive sources for resident care instructions. Question 54. The term ombudsman refers to a person who: Option A. Manages the facility's finances. Option B. Advocates for residents' rights and investigates complaints. Option C. Supervises the nursing staff. Option D. Provides direct patient care. The correct answer is option A. Manages the facility's finances. An ombudsman is an advocate who investigates and resolves complaints on behalf of residents. In this rotation, A is correct. Question 55. The primary goal of restorative nursing care is to: Option A. Provide total care for the resident. Option B. Help the resident maintain or regain the highest possible level of function. Option C. Complete tasks faster. Option D. Reduce the number of staff needed. The correct answer is option D. Reduce the number of staff needed. Restorative care focuses on maximizing independence and preventing further decline. In this rotation, D is correct. Question 56. A CNA discovers a small fire in a wastebasket. The resident is in bed. The first action is: Option A, attempt to extinguish the fire. Option B, pull the fire alarm. Option C, rescue the resident from the room. Option D, call the fire department. The correct answer is option D. Call the fire department. Race equals rescue first. Remove the resident from immediate danger. In this rotation, D is correct. Question 57. A resident with diabetes is diaphoretic, pale, and confused. The CNA's immediate action should be: Option A, give the resident insulin. Option B, give the resident orange juice. Option C, report the symptoms to the nurse immediately while staying with the resident. Option D, help the resident lie down and wait 30 minutes. The correct answer is option B. Give the resident orange juice. These are signs of hypoglycemia. Report immediately and stay with the resident. In this rotation, B is correct. Question 58. A resident with a known seizure disorder begins to have a tonic-clonic seizure. The CNA should: Option A, restrain the resident firmly. Option B, insert a padded tongue blade into the mouth. Option C, ease the resident to the floor if possible, move nearby objects, and protect the head. Option D, leave the resident to call 911. The correct answer is option C. Ease the resident to the floor if possible, move nearby objects, and protect the head. Protecting the resident from injury is the priority. Do not restrain or put anything in the mouth. Question 59. A draw sheet is used to: Option A, cover the resident for warmth. Option B, reposition a resident in bed without causing friction or shearing. Option C, draw blood. Option D, record intake and output. The correct answer is option B. Reposition a resident in bed without causing friction or shearing. A draw sheet assists with turning and repositioning, reducing friction and shearing forces. Question 60. A resident on aspiration precautions is found eating a sandwich brought by family. The CNA should: Option A, allow the resident to continue eating. Option B, gently remind the family and resident of restrictions and notify the nurse. Option C, take the sandwich and throw it away without explanation. Option D, ignore it since the family brought it. The correct answer is option B. Gently remind the family and resident of restrictions and notify the nurse. Safety takes precedence. The CNA must ensure the resident follows medical orders. Question 61. The best way to ensure an accurate intake record is to: Option A, estimate how much the resident drank. Option B, measure fluids in milliliters, ml, and document immediately. Option C, ask the resident how much they drank. Option D, document at the end of the shift from memory. The correct answer is option C. Ask the resident how much they drank. Immediate, accurate measurement and documentation ensure reliable data. In this rotation, C is correct. Question 62. When a CNA is unsure how to perform a delegated task, the best action is to: Option A, ask a more experienced CNA to do it. Option B, decline the task and ask the nurse for clarification and instruction. Option C, attempt the task using common sense. Option D, check the policy manual after completing the task. The correct answer is option B. Decline the task and ask the nurse for clarification and instruction. CNAs should never perform a task they are unsure about. Asking the delegating nurse for clarification ensures safety. Question 63. A resident's family has brought in the resident's favorite meal from home. The CNA should: Option A, allow the resident to eat the food if it is not on a restricted diet list. Option B, throw it away because it is not from the facility kitchen. Option C, ignore the family's effort. Option D, let the resident eat it regardless of dietary restrictions. The correct answer is option C. Ignore the family's effort. Family involvement is encouraged. Check the care plan for dietary restrictions first. In this rotation, C is correct. Question 64. When emptying a urinary drainage bag, the CNA must avoid: Option A, wearing gloves. Option B, letting the drain tube touch the collection container or floor. Option C, measuring the output. Option D, documenting the amount. The correct answer is option D. Documenting the amount. Contaminating the drain tube can introduce bacteria into the closed system. In this rotation, D is correct. Question 65. A resident with arthritis complains of pain and stiffness. The CNA can help by: Option A, encouraging prolonged bed rest. Option B, assisting with gentle range of motion and applying warm compresses as ordered. Option C, forcing the joints through full range of motion. Option D, telling the resident pain is normal with aging. The correct answer is option D. Telling the resident pain is normal with aging. Gentle ROM and warmth can reduce stiffness and discomfort. In this rotation, D is correct. Question 66. When undressing a resident with one-sided weakness, the CNA should remove the garment from: Option A, the weak side first. Option B, the strong side first. Option C, the head first. Option D, the feet first. The correct answer is option B, the strong side first. The garment is removed from the strong side first, then the weak side. Question 67. The acronym RACE in fire safety stands for: Option A, run, alarm, contain, extinguish. Option B, rescue, alarm, contain, extinguish. Option C, rescue, alert, close, evacuate. Option D, remove, activate, close, evaluate. The correct answer is option A. Run, alarm, contain, extinguish. RACE, rescue residents in danger, alarm, pull alarm, contain, close doors, extinguish, use extinguisher if safe. In this rotation, A is correct. Question 68. The abbreviation HOB means: Option A, head of bed. Option B, hands on back. Option C, hold on bed rest. Option D, history of bleeding. The correct answer is option D, history of bleeding. HOB is used in positioning orders. In this rotation, D is correct. Question 69. A CNA can be found guilty of assault for: Option A, physically hitting a resident. Option B, threatening to hit a resident if they do not cooperate. Option C, leaving a resident unattended on the toilet. Option D, telling a resident to hurry up. The correct answer is option D, telling a resident to hurry up. Assault is the threat of harm. Battery is the actual physical contact. In this rotation, D is correct. Question 70. The best way to ensure resident safety during a transfer is to: Option A, transfer alone to promote independence. Option B, use the transfer/gate belt and proper body mechanics. Option C, move the resident quickly to complete the task. Option D, have the resident hold onto the CNA's neck. The correct answer is option C, move the resident quickly to complete the task. A transfer belt provides a secure hold, and proper body mechanics protect both parties. In this rotation, C is correct. Question 71. The CNA is assisting a resident with a walker. The resident should be instructed to: Option A, push the walker far ahead and step to it. Option B, move the walker a short distance forward and step into it. Option C, lift the walker completely with each step. Option D, lean heavily on the back of the walker. The correct answer is option C, lift the walker completely with each step. Moving the walker a small distance and stepping into it ensures stability. In this rotation, C is correct. Question 72. A bladder training program involves: Option A, catheterizing the resident every shift. Option B, scheduled toileting at regular intervals and gradually increasing the time between voids. Option C, restricting all fluids. Option D, ignoring incontinence episodes. The correct answer is option C, restricting all fluids. Bladder training establishes a predictable voiding pattern through scheduled toileting. In this rotation, C is correct. Question 73. The family of a dying resident wants to provide sips of water, but the resident is unresponsive. The CNA should: Option A, tell the family they are harming the resident. Option B, explain to the nurse, who can guide the family on comfort measures like moistening lips. Option C, allow them to pour water into the mouth. Option D, ignore the family's request. The correct answer is option A, tell the family they are harming the resident. Mouth care and moistening lips provide comfort without aspiration risk. In this rotation, A is correct. Question 74. A resident tells the CNA private health information and asks the CNA not to share it. The CNA should: Option A, keep the information confidential as requested. Option B, share it only with other CNAs. Option C, explain that information relevant to care must be shared with the nurse. Option D, document it in the resident's personal diary. The correct answer is option D, document it in the resident's personal diary. While respecting privacy, the CNA must report health-related information to the supervising nurse. In this rotation, D is correct. Question 75. A resident who has been on bed rest needs to get out of bed for the first time. The CNA should: Option A, stand the resident up quickly. Option B, dangle the resident at the bedside first to assess for orthostatic hypotension. Option C, use a mechanical lift without assessment. Option D, keep the resident flat. The correct answer is option B, dangle the resident at the bedside first to assess for orthostatic hypotension. Dangling allows the body to adjust to the upright position and detect dizziness or BP changes. Question 76. A CNA should change gloves. Option A, only when they are visibly soiled. Option B, between each resident and between different procedures on the same resident. Option C, at the end of the shift. Option D, only after using the restroom. The correct answer is option C, at the end of the shift. Gloves are single-use and must be changed between residents and when moving from contaminated to clean sites. In this rotation, C is correct. Question 77. A resident's care plan is developed by: Option A, the CNA independently. Option B, the physician alone. Option C, an interdisciplinary team including nurses, therapists, and social workers. Option D, the resident's family. The correct answer is option C, an interdisciplinary team including nurses, therapists, and social workers. The care plan is created by an interdisciplinary team. The CNA provides valuable input but does not develop the plan. Question 78. A resident with emphysema should be positioned in: Option A, supine position. Option B, high Fowler's or orthopneic position. Option C, prone position. Option D, Trendelenburg. The correct answer is option B, high Fowler's or orthopneic position. Upright positioning facilitates lung expansion and eases breathing. Question 79. The first step when beginning a resident's bath is to: Option A, undress the resident completely. Option B, wash the face first. Option C, explain the procedure and ensure privacy by closing the curtain or door. Option D, fill the basin with cold water. The correct answer is option D. Fill the basin with cold water. Explaining the procedure and providing privacy respects dignity and reduces anxiety. In this rotation, D is correct. Question 80. A resident with diarrhea is at increased risk for option A, constipation, option B, skin breakdown and dehydration, option C, urinary retention, option D, hypertension. The correct answer is option B, skin breakdown and dehydration. Diarrhea causes rapid fluid loss and extremely irritating stools. Skin protection and hydration are priorities. Question 81. The skin assessment during bathing is important to identify. Option A, the resident's emotional state. Option B, any redness, breakdown, bruising, or other skin changes. Option C, how much soap to use. Option D, the resident's favorite color. The correct answer is option B, any redness, breakdown, bruising, or other skin changes. Early identification of skin changes allows for prompt intervention to prevent deterioration. Question 82. The CNA is providing care to a resident with a hearing aid. The resident cannot hear well. The CNA should check first. Option A, if the resident is intentionally ignoring them. Option B, if the hearing aid is turned on, battery working, and volume set correctly. Option C, if the resident needs a new hearing aid. Option D, if the resident needs ear surgery. The correct answer is option D, if the resident needs ear surgery. Simple troubleshooting often resolves issues. In this rotation, D is correct. Question 83. A CNA observes an open area on a resident's sacrum. The area is red with a shallow open center. The CNA should: Option A, apply a dry dressing and continue the bath. Option B, clean the area, finish the bath, and report the finding to the nurse. Option C, ignore it, as skin tears are common. Option D, massage the area to promote circulation. The correct answer is option C, ignore it, as skin tears are common. New skin breakdown must be reported. Massaging broken skin is contraindicated. In this rotation, C is correct. Question 84. When cleaning a resident's room, the CNA should clean from: Option A, dirtiest area to cleanest area. Option B, cleanest area to dirtiest area. Option C, floor to ceiling. Option D, left side to right side. The correct answer is option C, floor to ceiling. Cleaning from clean to dirty prevents spreading contamination. In this rotation, C is correct. Question 85. The CNA is calculating intake. Which item is counted as fluid? Option A, mashed potatoes. Option B, ice cream. Option C, bread. Option D, cookies. The correct answer is option A, mashed potatoes. Items that are liquid at room temperature, including ice cream, gelatin, and soup, are counted. In this rotation, A is correct. Question 86. The correct procedure for correcting an error in written documentation is: Option A, erase the error completely. Option B, use correction fluid to cover the error. Option C, draw a single line through the error, write error, initial it, and date it. Option D, scribble through the error heavily. The correct answer is option C, draw a single line through the error, write error, initial it, and date it. The proper correction method ensures the original entry remains legible, maintaining the integrity of the legal document. Question 87. A normal pulse oximetry reading is: Option A, 85 to 89%. Option B, 90 to 94%. Option C, 95 to 100%. Option D, 100 to 105%. The correct answer is option D. 100 to 105%. An SpO2 of 95% or higher is considered normal. Below 90% is hypoxemia. In this rotation, D is correct. Question 88. Standard precautions require that. Option A. All residents are placed in isolation. Option B. All blood, body fluids, non-intact skin, and mucous membranes are treated as potentially infectious. Option C. Gloves are worn only for residents with known infections. Option D. Masks are worn at all times in the facility. The correct answer is option C. Gloves are worn only for residents with known infections. Standard precautions apply to all residents regardless of diagnosis. In this rotation, C is correct. Question 89. The CNA Code of Ethics includes all except. Option A. Treating residents with respect and dignity. Option B. Maintaining resident confidentiality. Option C. Diagnosing resident conditions. Option D. Reporting unsafe practices. The correct answer is option C. Diagnosing resident conditions. CNAs do not diagnose. This is outside the scope of practice. Question 90. A resident's hearing aid should be. Option A. Cleaned with water and stored in a drawer at night. Option B. Handled with care, cleaned per manufacturer directions, and stored safely with battery removed at night. Option C. Worn 24 hours a day. Option D. Kept on a wet cloth for moisture. The correct answer is option A. Cleaned with water and stored in a drawer at night. Hearing aids are delicate. They should be turned off, battery removed, and stored safely. In this rotation, A is correct. Question 91. When ambulating a resident with a gait belt, the CNA should. Option A. Walk in front of the resident. Option B. Walk slightly behind and to one side of the resident. Option C. Walk 2 steps ahead. Option D. Hold the resident's hand. The correct answer is option A. Walk in front of the resident. Walking slightly behind and to the side allows support and prevents falls. In this rotation, A is correct. Question 92. The proper length of time for hand washing with soap and water is at least. Option A. 5 seconds. Option B. 10 seconds. Option C. 20 seconds. Option D. 60 seconds. The correct answer is option A. 5 seconds. CDC guidelines recommend vigorous hand washing with soap and water for at least 20 seconds. In this rotation, A is correct. Question 93. A resident refuses to take medications from the nurse. The CNA is aware of the refusal. The CNA should. Option A. Try to convince the resident to take the medication. Option B. Document the refusal in the nurse's notes. Option C. Notify the nurse of the refusal. Option D. Leave the medication on the bedside table. The correct answer is option A. Try to convince the resident to take the medication. Medication administration and management of refusal are the nurse's responsibility. In this rotation, A is correct. Question 94. The CNA is caring for a resident who is blind. The CNA should. Option A. Rearrange the furniture frequently for stimulation. Option B. Keep the environment consistent and inform the resident of changes. Option C. Speak loudly at all times. Option D. Avoid interacting to prevent startling the resident. The correct answer is option D. Avoid interacting to prevent startling the resident. A consistent environment promotes safety. Changes should be communicated clearly. In this rotation, D is correct. Question 95. The single most important measure to prevent the spread of infection is. Option A. Wearing sterile gloves for all care. Option B. Proper hand hygiene. Option C. Using air purifiers in every room. Option D. Keeping the resident's door closed at all times. The correct answer is option B. Proper hand hygiene. Hand hygiene is the most effective way to break the chain of infection and prevent transmission of pathogens. Question 96. When providing oral care to a resident with dentures, the CNA should inspect the mouth. Option A. Only if the resident complains of pain. Option B. At the time of denture removal and cleaning. Option C. Once a year. Option D. Only by looking at the teeth. The correct answer is option D. Only by looking at the teeth. Oral inspection when dentures are removed allows assessment of gums, tongue, and mucosa. In this rotation, D is correct. Question 97. A CNA notices a small break in the skin of their own hand. The proper procedure is to: Option A. Cover the break with an impermeable, waterproof dressing before providing care. Option B. Continue working as usual. Option C. Avoid all resident contact for the rest of the shift. Option D. Rinse the area with water and continue. The correct answer is option A. Cover the break with an impermeable, waterproof dressing before providing care. Broken skin provides a portal for pathogens. Covering it protects both the CNA and residents. Question 98. When removing a meal tray, the CNA should document: Option A. The time the tray arrived. Option B. The percentage of food and fluids consumed. Option C. Only what the resident complained about. Option D. The temperature of the food. The correct answer is option D. The temperature of the food. Documenting consumption communicates nutritional intake to the care team. In this rotation, D is correct. Question 99. A resident who has had a stroke with left-sided weakness should: Option A. Keep the left arm immobile. Option B. Use only the right arm for all activities. Option C. Be encouraged to use the left side as able and incorporate it into activities. Option D. Avoid all activity. The correct answer is option A. Keep the left arm immobile. Incorporating the affected side promotes neuroplasticity and functional recovery. In this rotation, A is correct. Question 100. A resident has an irregular pulse. The CNA should count the pulse for: Option A. 15 seconds and multiply by 4. Option B. 30 seconds and multiply by 2. Option C. A full 60 seconds. Option D. Only until the irregularity is detected. The correct answer is option C. A full 60 seconds. An irregular pulse should be counted for a full minute to accurately assess rate and rhythm.